Hello, my name is Rola. I'm a student NP and I'm going to do a physical assessment on you. I'm ready to wash my hands, so we're just going to get started. So I'm going to start by taking a look at your head and scalp, making sure there's no lesions, scales, your hair is evenly distributed, it is soft to touch, there's no baldness, and the head of your size is normal for your size of your body. I'm going to palpate for your temporal pulses, and they're both 2+, normal, present. Your face is symmetrical. There are no lesions, masses, scarring, no hirsutism. The hair on your eyebrows and lashes are evenly distributed and they're symmetrical. Your lids are over your eyes evenly. Your sclera is white. There's no jaundice. Your iris is brown, both of them. The canduses, both of them, are moist and pink, and there's no extra tears. I'm going to check for your conjunctiva. Bottom ones are pink and moist, and your top ones are also pink and moist. So there are a few eye exams that I'm going to perform on you. The first one is for the light. I'm going to shine the light for your pupil. So there's two different ones. One is direct to see if your pupils constrict evenly, and the other one, I'm going to shine a light in your left eye, look at your right eye to see that the right eye constricts, and it does. They're both round and equal, symmetrical, and 3 mm. Normally you would do it for both sides. Just because of time, we're going to do one at a time. Then I'm going to do your peripheral vision. Let me know when you see my fingers by saying now.
Yeah.
Okay, I'm going to ask you to follow my finger, do not move your head, and this is to see accommodation and conversion. So your eyes do go inwards and constrict, and when they go outwards, they dilate and they're symmetrical. And then the last one is I'm going to ask you to follow my finger once again for extraocular issues. Okay. No nystagmus noted. I'm going to shine a light in your eye again. I'm going to put the speculum to my left eye and look into your left eye. And I'm looking for the red eye reflex, which is going to show me your retinal vessels, your macular, for no macular degeneration. There's no scarring, and looks good, and no vision loss. Okay. Next thing I'm going to do is I am going to assess your nose. I'm going to palpate your frontal sinuses. Let me know if you feel anything. Your maxillary and your nose itself. Nope. I'm going to take a look into your nose, and I'm going to take a look to see if there's any deviation, any signs of infection. Normally I look into both, but for time. Okay, there's no deviation, no polyps, pink and moist. I'm going to perform a smelling test. So I'm going to ask you to close one nostril and let me know what you smell.
Alcohol?
Yes. And I would do it again in the other one. Okay, the next thing I'm going to do is look at your mouth. Your lips are pink and moist. Teeth seem like they're all present. I'm going to shine a light inside. Your buccal mucosas are both pink and moist. Palates are pink and moist. Tongue is pink and moist. Underneath the tongue, I see your salivary. They're pink, and I see the blue vessels in the back side off of me. Okay, your tonsils, 1+. There are no whiteness or swellingness. Next thing I'm going to do is I'm going to assess your ear. There are a few tests for the ear. First, I'm going to start by palpating for any lesions, nodules, none that I feel. I'm going to touch your mastoid process. Let me know if you feel any tenderness. Pull on your pinna. Any tenderness? No. I'm going to take a look inside your ear for any cerumen, redness, ruptures. Take a look. A little bit of cerumen. I'm pointing this speculum inwards and down. Okay, see the tympanic membrane pearly. The clock, and your right is the 5 o'clock, and then on the left it would be 7 o'clock. I'm going to perform some more ear exams to let me know if you're having any central hearing loss. So the first one is a Weber test. I'm gonna strike the tuning fork, place it in the middle of your head. You can let me know if you hear the vibration equally in both ears.
Yes.
Okay. The next test is a Ryan test, and I'm gonna strike it, place it on the bone behind your ear, and then I'm gonna time it. And then I'm gonna place when you stop hearing it, you're gonna let me know. I'm gonna place it in the air close to your ear, and when you stop hearing it, you're gonna let me know once again. I'm gonna time it. Usually AC is greater than BC. Ready? Sorry.
No. No.
Okay, so in your case, AC is greater than BC. Last test that I'm going to do for your ear is to see a whisper test. So I'm going to say a few things and you're going to repeat back to me. Usually it's on both sides, but once again, I'm just doing it on one.
ABC. 1, 2, 3.
Great. Next, I'm going to assess your lymph nodes. You have the periauricular lymph nodes, your postauricular lymph node, your occipital lymph nodes, your tonsillar lymph nodes, your submandibular, your submantle, and the cervical chain. There's 3: posterior, deep, and superficial. They are usually hard to assess because they're so deep in. And then supraclavicular. Now, normal findings with lymph nodes, you won't be able to feel them or palpate them unless there's an infection or like cancer or whatnot. I'm gonna move on to your chest. Before your chest, I'm gonna take a look at your trachea to make sure that it's symmetrical. There's no deviation, and it is. Then I'm gonna assess for your thyroid. I'm gonna feel for any nodules. I'm gonna find the opening. Feels like I'm choking you. Swallow. Good. And I feel your thyroid going up and down. No nodules present. Now I'm gonna assess your chest. I'm gonna usually have you not wearing anything, take a look at your skin, but because we are recording, not trying to invade privacy. So for the skin, I would look for any lesions, scarring, your respiratory rate, which is normally between 12 and 20. I'm gonna look for any bulgingness while you're breathing, and there aren't any present. I'm gonna palpate for any present masses. Nothing felt. I'm going to percuss, and usually you percuss in between the intercostal spaces and ladder. Just gonna skip over a bit. Okay. And you do it side by side to compare. I'm going to ask you to say 99.
99. 99. 99. 99. 99.
Okay, and I do feel the vibrations up front, and then they do disappear, and the purpose is to feel for consolidation. I'm going to take a listen to your lungs. You do ladder side by side. Take a deep breath in when I tell you to. So one sound would be more bronchovesicular up top, and as you weigh your way down, it'll be more vesicular. And you're listening for one long breath each time. Okay. So now I'm going to ask you to turn your back. So just because the purpose of timing, you would do the same thing. Inspect the skin, palpate for any lesions, percuss, and all the way down. When I auscultate, I'm going to have you say 99 as I touch one more time.
99. 99. 99. 99. 99. 99.
Okay, and it does, again, there's no consolidation because it does disappear. And then I'm going to have you do a whisper test. I'm going to ask you to whisper 99 every time I place my stethoscope. Okay, and normally it is muffled, and that's what I heard. I'm going to ask you to do the egophony test. And the purpose of this is to make sure when you say E, it remains as an E and that does not change as an A for consolidation. So say E.
E. E. E. E. E. E. E. E. E. E. E. E.
Good. The last test I'm going to do is I'm going to do the chest expansion. Well, not last test, but close. Okay, and it is symmetrical because my hands do symmetrically expand, and your AP is 1 to 2, which is normal. And last but not least for the lungs is I'm going to assess your diaphragm placement. So I'm going to ask you to take a deep breath in and hold it, and then I'll ask you to exhale and hold it, and I'm going to percuss. Okay, so change of sound is about here. I'm going to mark it with your shirt. And now exhale and hold it. Normally, it is about 3 to 5 centimeters. And when I measure, you are about 3.5 centimeters, which is norm. Okay, last is the Snellen test. And I'm just going to ask you to read
T. X. T.
Good.